Many people wonder, what exactly does a sex educator do? Simply put, we're here to provide accurate and accessible information about sex and relationships. We create a safe space for individuals to learn, ask questions, and explore their sexuality without shame or judgment. Our role isn't about telling people what to do. Instead, we empower individuals to make informed decisions about their bodies and relationships. We address a wide range of topics, from puberty and contraception to communication, consent, and pleasure. Sex education goes beyond the biological. It encompasses the emotional, social, and cultural aspects of sexuality. We recognize that everyone's experience is unique, and we strive to create an inclusive environment for all genders, sexual orientations, and relationship styles. Ultimately, our goal is to promote healthy sexuality and relationships. We want individuals to feel confident in their bodies, empowered to make their own choices, and equipped to navigate the complexities of sex and relationships throughout their lives. As sex educators, we encounter a wide range of questions. People are often curious about topics that are considered taboo or difficult to discuss openly. Many individuals have questions about their own bodies and experiences, wondering if what they're going through is normal. Common questions revolve around desire, arousal, and orgasm. People want to understand how their bodies work, how to communicate their needs, and how to enhance their sexual experiences. Body image is another prevalent concern, with many individuals feeling self-conscious or anxious about their appearance during sex. We also receive questions about relationships, consent, and communication. People want to know how to navigate the complexities of intimacy, how to set boundaries, and how to talk to their partners about sex. It's important to remember that there's no such thing as a stupid question when it comes to sex and relationships. We're here to provide accurate information and support no matter what the question may be. One of the most important things to remember about sexual health is that everyone's experience is unique. There's no right way to experience sexuality, and what feels good for one person may not feel good for another. Our bodies respond to stimuli in different ways, and our emotional and psychological responses to sex can vary greatly. It's essential to approach sexual exploration with a sense of curiosity and self-compassion. Listen to your body, pay attention to what feels good, and don't be afraid to communicate your needs to your partner. Comparison can be the thief of joy, especially when it comes to sex. Avoid comparing your experiences to those of others, whether it's friends, family, or what you see in the media. Embrace your individuality and focus on what feels good for you. Remember, sexuality is a journey, not a destination. It's a process of self-discovery that unfolds over time. Be patient with yourself, explore at your own pace, and celebrate the diversity of human sexual experience. Initiating sex can feel daunting, even in established relationships. It's important to remember that communication is key. Start by talking to your partner about your desires and boundaries. Direct communication is often the most effective approach. Expressing your interests clearly and respectfully can alleviate anxiety and ensure both partners are on the same page. For example, you could say, "I'm really in the mood tonight. How about we spend some time together later?" However, directness isn't the only way. Some people find it easier to initiate sex through physical touch, such as cuddling, kissing, or massage. Nonverbal cues can also be effective, like dimming the lights or putting on music that sets the mood. The most important thing is to create an environment of comfort and consent. Check in with your partner throughout the process to ensure they're feeling comfortable and enthusiastic about taking things further. Remember, no always means no, and consent can be revoked at any time. Section 5. The pleasure principle. Understanding lubrication. Lubrication plays a crucial role in sexual pleasure and comfort. It reduces friction, preventing discomfort or pain during intercourse. Many factors can affect lubrication, including stress, medication, and hormonal fluctuations. Natural lubrication isn't always sufficient, and that's perfectly normal. Using lube can enhance pleasure and make sex more enjoyable for both partners. There's no shame in needing a little extra help to get things going. A wide variety of lubes are available, each with its own benefits and drawbacks. Water-based lubes are the most common and versatile. They're safe to use with condoms and easy to clean up. Silicone-based lubes are longer-lasting and ideal for use in the shower or bath. Experiment with different types of lube to find what works best for you and your partner. Don't hesitate to ask a healthcare provider or sex educator for recommendations. Remember, lube is your friend. Section 6. Embracing your body confidence between the sheets. Body image is a common concern for many people, and it can significantly impact our experiences with sex. We live in a society that often promotes unrealistic beauty standards, leading to feelings of self-consciousness and inadequacy. It's essential to remember that there's no perfect body type. Beauty comes in all shapes, sizes, and colors. Focus on embracing and appreciating your body for what it is, rather than striving for an unattainable ideal. Confidence comes from within. Practice self-love and acceptance by engaging in activities that make you feel good about yourself. This could include exercise, spending time in nature, or pursuing hobbies that bring you joy. Talking openly with your partner about your insecurities can also be helpful. Creating an environment of trust and acceptance can make a world of difference in how you feel about your body during sex. Remember, vulnerability can be incredibly powerful in deepening intimacy and connection. Section 7. The ebb and flow. Desire in long-term relationships. It's normal for desire to fluctuate over time in long-term relationships. Life's stressors, hormonal changes, and the natural ebb and flow of intimacy can all affect libido. It's important to remember that this is a normal part of being in a long-term relationship and doesn't necessarily signal a problem. Communication is key to navigating changes in desire. Talk to your partner openly and honestly about what you're experiencing. Listen to their needs and concerns without judgment. Collaboratively finding solutions that work for both of you is essential. Exploring ways to reignite the spark can be helpful. This could involve trying new things in the bedroom, scheduling regular date nights, or simply making an effort to connect on a deeper emotional level. Remember, intimacy thrives on connection, both inside and outside the bedroom. If you're struggling to navigate changes in desire on your own, seeking professional help from a therapist or counselor specializing in sex and relationships can be incredibly beneficial. They can provide a safe and supportive space to explore these issues and develop strategies for moving forward. Section 8. The orgasm question. Release without pressure. Orgasms can be a wonderful part of sex, but it's important to remember that they're not the be-all and end-all. Not everyone climaxes every time, and that's perfectly okay. Focusing solely on achieving orgasm can create pressure and detract from the overall enjoyment of the experience. Many factors can affect orgasm, including stress, medication, and relationship dynamics. It's essential to approach sex with a sense of playfulness and exploration, rather than viewing it as a performance. Focus on what feels good in the moment, and don't be afraid to communicate your needs to your partner. If you're experiencing difficulties achieving orgasm, there are things you can try. Experimenting with different types of stimulation, positions, and toys can be helpful. Understanding your own anatomy and what brings you pleasure is key. If you're concerned about your ability to orgasm, it's always a good idea to consult with a healthcare provider or sex therapist. They can rule out any underlying medical conditions and provide guidance on how to enhance your sexual pleasure. Section 9. Beyond the bedroom, the spectrum of sexual health. Sexual health encompasses much more than just what happens in the bedroom. It's an integral part of our overall well-being and includes physical, emotional, mental, and social aspects. Taking care of our sexual health involves making responsible choices that protect us from sexually transmitted infections, or STIs, and unintended pregnancies. Regular STI testing is crucial, even if you're in a monogamous relationship. Many STIs can be asymptomatic, meaning you may not experience any symptoms even if you're infected. Getting tested regularly allows for early detection and treatment, preventing long-term health complications. Contraception is another vital aspect of sexual health. There are many different methods available, each with its own pros and cons. It's important to choose a method that's right for you based on your individual needs and preferences. Beyond physical health, sexual health also encompasses our emotional and mental well-being. Feeling good about ourselves, setting boundaries, and communicating effectively with our partners are all crucial components of healthy sexuality. Section 10. Finding your voice. Asking for help and information. It's perfectly normal to have questions about sex and relationships. We all start somewhere, and there's no shame in seeking out accurate and reliable information. Fortunately, there are many resources available to help you learn and explore your sexuality in a safe and supportive environment. Talking to a trusted healthcare provider is a great place to start. They can answer your questions, provide medical advice, and connect you with other resources in your community. Sex educators, therapists, and counselors specializing in sex and relationships are also valuable sources of information and support. The internet can be a helpful tool for finding information, but it's essential to be discerning about the sources you trust. Look for websites run by reputable organizations like Planned Parenthood, Scarleteen, or the American Sexual Health Association. Remember, you're not alone in your curiosity about sex. Millions of people have questions and concerns, and there are countless resources available to help you find the answers you seek. Section 11. Embracing your sexuality, a journey of self-discovery. Sexuality is a fundamental part of what makes us human. It's a journey of self-discovery that unfolds throughout our lives. Embracing our sexuality involves understanding our bodies, desires, and boundaries. It means feeling comfortable in our own skin and celebrating the diversity of human sexual expression. Don't be afraid to explore your sexuality with curiosity and an open mind. Listen to your body, communicate your needs, and respect the boundaries of others. Remember, there's no right way to experience sexuality. What matters most is that you feel safe, respected, and empowered to make choices that align with your values and desires. If you're struggling with any aspect of your sexual health or well-being, please reach out for help. You deserve to live a life filled with pleasure, intimacy, and fulfillment.